Hi guys, welcome back to my channel. It's Dr. Saru. I hope you've been keeping up well. So, had engaged a few of you on my Instagram and TikTok, and you really had requested for this topic, H Pylori. So I hope you're going to find it informative and it can clear a bit of some doubt that watu wamekuwa nayo sana. If you're new to this channel, please be sure to subscribe. If you're coming back, karibu sana. And if you've not subscribed, please do so. I mean, can't you see all these things we are learning in this place? So, basically, today I would like to talk about H. pylori. What is H. pylori? H. pylori, Helicobacter pylori. It is a gram-negative rod bacteria. Audience who are also in the medical field and might like to maybe refresh their whatever. So it's a gram-negative rod bacteria. It is normally found in almost over 50% of us. So kila mtu, majority of us, like 5 out of 10 people have H. pylori in their stomachs, but haina any symptoms. So for that, we normally don't treat. But I'd like to tell you more about it. So since we know that H. pylori is actually a bacteria, yeah? What happens? What is the thing that causes H. pylori to give you the symptoms that it does? H. pylori on its own can make you develop ulcers ama vidonda kwa tumbo. There are several mechanisms as to that, as to how that happens. For example, when you get infected by H. pylori, which I've already told you, 50% of the total general population, over 50% already have the bacteria in their stomachs. But what happens when you're having this, when you already have enough, labda umekuwa na H. pylori yenye imekucause mpaka upate infection? What happens is the H. pylori itself has a way of eroding the mucosa layer. Na ikiwa inaendelea kuchimba hivyo, when it goes down, when it's already going down, the mucosal membrane, remember, is the protective layer for our stomachs. When it goes down, it may erode, then it exposes the lining of the stomach to what? To the acid yenye we naturally produce, yenye inasaidia kudigest chakula. And that acid is the one that is going to totally erode your lining na itakufanya upate nini? Vidonda za tumbo ama you get ulcers. I'll link down the videos that I've done about vidonda za tumbo or ulcers and also about hyperacidity so that you can at least learn about what other causes could be leading to hyperacidity and not H. pylori. So some of the symptoms of H. pylori are heartburn or epigastric pain. Number 3, nausea ama kusikia kutapika. Number 4, vomiting. Some people will also complain of vomiting. Number 5, unaweza kusikia like there's a bit of discomfort kwa tumbo ama bloating, ya kwamba you feel like your stomach kila masaa ni kama imejaa gas. Saa ingine pia number 6, kupitisha hewa sana ama kunyamba, that is flatulence. And number 7, sometimes you can feel like watu wanasema the stomach is rumbling, like unasikia hiyo kelele because of the gas that is a lot in your stomach. So now that you know the symptoms of H. pylori, I would want to clarify one thing. Not every time you have symptoms of hyperacidity, it's secondary to H. pylori. The other infective causes zenye zinaweza kusababisha ukapata H. pylori, of which I'll be talking about it next. I think next week in the coming video. That is web. I've seen so many people having issues with it and like we need to talk about it. So hyperacidity pia could also be drug induced ama inaweza kuwa kwa sababu ya stress pia, you know, and certain foods pia zina induce hyperacidity. Not all the time you have those symptoms automatically inamaanisha uko na H. pylori, because I've seen most people coming in the hospital, they claim that they have these symptoms and all of a sudden they already want to get medication for H. pylori without having to do any tests. So now that we know there is something called hyperacidity on a separate entity, and then we also have now the H. pylori, which is part of the hyperacidity issue. You'd ask yourself, nikifika hosi, labda daktari ataniambia nataka kunipima nini na nitajua ni nini nafaa kutolewa. Is it damu or what is it that unatolewa? So in some countries they still do the antibody test for blood, lakini huku kwetu commonly we do a stool test. So for the stool test ni ya kutest for antigen ya H pylori. Unapeana choo yako sample kwa lab, they'll tell you if it's positive or negative. The other one is called urea breath test, which in our country it's not very commonly practiced. However, it's also a way to diagnose if you have H pylori. Another thing that I have to talk about is, in case you've been treated or you've been treating yourself, you're going to a chemist, or rather you're going to a lab, unafanywa stool test, you have H pylori, and you've been treating it over and over again, and you still have persistent symptoms, it is good that you get to be seen by a doctor, so that maybe aweze kukufanyia some imaging tests kama endoscopy ama OGD, or you can also do a barium swallow ambayo pia inaweza kuonesha kama umedevelop ulcers, because other than the fact that H pylori inaweza kupatia hizo signs za hyperacidity, H pylori pia is known to cause ulcerations and ulcers in the stomach. So the other thing, now that we know what are the causes, or rather what are the symptoms and signs of H pylori, we know how to diagnose, or the samples you're going to use for diagnosis. The treatment part. You know, I normally don't advocate for any treatment because I am pro people to be seen by their individual doctors and for them to get their personalized services. However, it is very standard for H pylori treatment. It's either triple therapy, or quad therapy. Where in triple therapy, which is the commonest that we use even locally, it includes 2 antibiotics and a PPI. A PPI is the thing that you guys have been commonly using, omeprazole, pantoprazole, rabeprazole, and the likes. Those are the PPIs. PPIs are basically proton pump inhibitors, and they reduce the amount of acid that is produced in your stomach, so that ipatiane time hiyo ulcer kuheal, na pia hizo bacteria ziweze kumalizwa na antibiotic yenye utakuwa umepatiwa, so that you can now get better and start to basically just help with reducing the amount of acid production in your stomach, while the antibiotics clear the bacteria and help and give time for the ulcer to heal if you've already developed an ulcer, or for that erosion area that was happening for it to heal. So the therapy normally takes 14 days, and it's called a H pylori eradication kit, because we believe after the 14 days you're not supposed to be having the H pylori infection. So failure for you to do the 14 days, then you end up doing what? Having to be at risk of getting the ulcer. And another thing I had not spoken of, other than the complications of H pylori being one, the ulcers, the gastric ulcers or duodenal ulcers, the duodenum, it's part of your small intestine, the upper part, the beginning of it. So if you fail to do the 14 days and you don't eradicate H pylori completely, and you've been having signs and symptoms, you're at risk of getting the ulcer. That is one of the complications. And 2, you can also be at risk of getting gastric cancer, which is normally induced also, or is secondary to H pylori infection. Sometimes either uncontrolled or even controlled H pylori infection, sometimes you can find yourself having that complication of getting a gastric malignancy. So if anytime you have any feelings as if ni kama uko na kiungulia, or you're having hyperacidity issues, or the symptoms that I've already mentioned before, please visit your nearest hospital so that you can be diagnosed correctly and get and treatment to be put into place the earliest possible. So sorry, I had forgotten about these questions that were asked through one of the TikTok lives that I was on, when I had requested for you guys to ask me questions regarding this topic. So there's Mr. Dash Msani. He'd asked, what is H pylori? I think I've already answered. It's gram-negative bacteria, rod bacteria, and its full name is Helicobacter pylori. Early stages of H pylori. This was asked by bestboy073. What are the early signs of our early stages of H pylori? Early stages including the epigastric pain, feeling heartburn, having nausea or vomiting, and kusikia tumbo inapiga kelele hivo, or feeling like your stomach is bloated or imejaa gas. Best Boy 73 also asked, how is H. pylori connected with heartburn? I think I've explained. H. pylori, not to take you to a microbiome class, but H. pylori has an enzyme on its surface called urease. Urease has the ability to do what? To break down the urea and water in your stomach into carbon dioxide and ammonia. So the carbon dioxide, wakati imejazana kwa tumbo, it makes you feel bloated. That is one, which when you're bloated, you can also feel like you perceive a heartburn. The other thing, when the H. pylori itself has started to erode the mucous membrane and it has gone deeper, as I had explained earlier, you'll realize that the acid can now get into contact with the cellular level where you can perceive that heat or you can perceive that burning sensation. And that's exactly what you call a heartburn. Because as I said, the mucous membrane is a protective layer, and in all manner of ways you'll not find it having that burning sensation naturally, unless you have a lot of gas because of maybe something you ate, or maybe it's stress induced, such as when you just come from a major surgery. Another question, I didn't put down the name of this username. What is the diagnostic test for H. pylori? I had already mentioned either urea breath test or the H. pylori antigen test, which is the one that we commonly use by using a stool sample. I hope I've answered all your questions. If you still guys have more questions, please don't be shy. Follow away, subscribe, and you can comment down below so that I can be able to answer that. And yeah, follow me on TikTok at Dr. Saru Cynthia. Follow me on Instagram at Dr. Saru Cynthia, Facebook at Dr. Saru Cynthia. You can also drop me an email at drsarucynthia@gmail.com. I'll definitely be happy to answer you to the best of my knowledge. So until next time, it's Dr. Saru. Hope you have a fantastic weekend. Love and love.